we'll still get on with that. So why becoming an entrepreneur? Entrepreneurs are their own bosses. They make the decision, they choose whom to do business with, and what work they will do. It offers a greater possibility of achieving significant financial reward than working for someone else. Though the risk is there, but the reward is usually greater than working for someone else. It also provides the ability to be involved in the total operation of the business, right from the concept to design and creation. It offers the prestige of being the person in charge. It gives an individual the opportunity to build equity, which can be kept, sold, or passed on to the next generation. Entrepreneurship creates an opportunity for a person to contribute to the local economy through his innovations and contribute to the society as a whole. Now, going into medical entrepreneurship. In our country, with the way things are going currently, the economy and all, most doctors nowadays lacks in starting up their business, in starting up their facilities, be it hospitals, labs, pharmacy, whatsoever it is, because of the rising costs. So medical entrepreneurship is the process of engaging in innovation and ventures in the field of healthcare. The application of entrepreneurship principles into the field of healthcare services, provision, and delivery. Please, am I audible?
Yes, you are.
All right, thank you. So I'll be checking from time to time, so I know I'm not speaking to myself. And I would love if this can be interactive as possible. So if there's any clarifications, it can be raised.
Okay, sir.
All right, thank you. So evidences showed that healthcare professionals lack significant training in the business field of healthcare. The gap between the medical training and business training have impaired doctors to become an integral part of the entrepreneurial and management world. This was by Talia et al. In 2014. So segments like biotechnology, data analysis, health apps, preventive medicine, mobile healthcare technology, and among others, these are some of the opportunities we can get as medical entrepreneurs. So who is a medical entrepreneur? A medical entrepreneur is any healthcare professional who is aware of the challenges, needs, tastes, preference, changes, and gaps in health sector. And the person is able to connect with the market opportunities to provide relevant health-oriented products. Now, entrepreneurs adopt what we call the double bottom line. So this double bottom line means gaining personal profit as well as making social impact. While this double bottom line, the entrepreneurs adopt this double bottom line to achieve both their financial and social success. Okay. It also enhances their brand image. It attracts talent. It attracts investors, builds trust with stakeholders, and fosters long-term sustainability and new opportunities. So this double bottom line framework recognizes a company's responsibility extends beyond just profit making, but it also includes commitment to the social, the societal well-being and environmental health. Now, in Nigeria, approximately 40,000 doctors support an estimated population of 196 million. This is as of 2019. And the World Health Organization revealed that Nigerians' physician to patient ratio is 4 doctors to 10,000 patients. So that means 1 doctor is to 2,500 patients. And in the US, the ratio is 26 doctors to that 10,000 patients, while UK has 28 doctors to 10,000 patients. Now, the WHO standard is meant to be 1 doctor to 200 patients. Also, the allocation of budgets as of 2018 was 3.9%, which is against the minimum recommended of 15%. So we know that patients will wait. If you go to general hospital, you see patients waiting for very long period of time before they see the doctors. Some patients get there by 6 a.m. while the doctors probably 9 we run our clinic, we start our clinic. So they've been there by 6, because of so much crowd. Now, the Daily Trust in 2019 kept an average of 9,000 medical tours, which occurs from Nigeria to other countries. The Nigerian authorities say the country is losing more than $1 billion annually to medical tourism, which is a significant amount of money. India benefits majorly with about 500 visits monthly. And the losses to medical tourism annually in Nigeria is around 359 billion naira, which is more than the 340 billion allocated to the health sector in the budget. So where are these opportunities in medical investment, in medical entrepreneurship? Where do we find these opportunities? In the hospitals, creation of hospitals, creation of outpatient clinics, not necessarily a hospital, establishment of pharmaceutical companies or a pharmacy store, diagnostic centers and laboratories, medical courier services. Sadly, in Nigeria, the courier services are not medical. There are no medical courier services I'm aware of. So we use things like DHL, ABC Transport for our courier. And we also have medical writing for those inclined and those who love to write. There's the medical waste disposal service, medical tourism. I think part of the president's wish, let me put it that way, is to make Nigeria a medical tourist country. And actually, there's a hospital at Abuja currently with leading, and innovative medical healthcare services, and they have patients from outside Nigeria. Okay, so when we say medical tourism, we shouldn't look at it as something not possible, since it's usually the other way around, where we go outside the country to have our health checked. But if you establish something very standard and you're good at what you do, you might not be a doctor in your facility. You don't have to be a doctor in your facility. You could hire other specialists, but the facility would be standard, or it would be so standardized to the extent that you get clients or patients from outside the country. We also have aesthetic medicine and cosmetics, starting up a medical college or nursing college, paramedical college, dental services, eye specialists, and weight loss clinics. There's also one very new innovation that I think, okay, it's new to Nigeria, and that's the EMS, the Emergency Medical Service, where you own ambulances, okay? Where there are emergencies, you go to that site, okay? You don't necessarily have to be part of the team. but you could be an investor in such companies, okay, where they go to the site of emergencies, pick them, administer first aid, and take them to the nearest hospital, nearest government hospital or a tertiary center. If none, then maybe a primary healthcare center. So that is another innovation that is another innovation that I've seen of recent, which is happening, and it's just one I've actually heard of, and it's in Lagos State. It's in Lagos State. Yeah. So also you could, though one would require licenses, which over time you can procure, you can get. This medical college and nursing college is also a very good investment. The nursing college has to be a standardized, approved by the Nursing and Midwifery Council of Nigeria. There are some hospitals that take people and train them as nurses, which they term in quotes auxiliary nurses. This is very wrong, and they are quacks actually. Even if it's the best doctors that train them, they are still quacks because they didn't go through the proper process and they don't have the license to practice. So, but starting up a nursing college, though it requires some capital, is a very good investment also. In the University of Ilorin, usually they have a very large number of students that go for medicine and surgery. But this year, the number that went for nursing was higher than that of medicine. So people are starting to realize, or people are starting to believe that nursing pays better. As a nurse, when you're done, you can still find a way, you can own an hospital. You partner with a doctor, you use the doctor's license, and then you find a way of sharing your profits. While nurses don't go through that same stress doctors go through, and yet you can still achieve the same thing or more than what doctors achieve. All right. So we also have paramedical allied colleges. We have dental services, eye specialist clinics, and weight loss centers. Characteristics of an entrepreneur. We have creativity. Creativity is like the spark that drives the development of new products or ways to do business. That spark, okay? It is the push for innovation and improvement. It is continuous learning, questioning, thinking, rethinking, and thinking outside the box. We also have dedication, which is what motivates the entrepreneur to work hard, work 12 hours in a day or more, or even 7 days in a week, especially at the beginning of the company when it is just starting up, just to make sure it lifts properly from the ground. There's also determination. We also have flexibility. These are some of the characteristics of an entrepreneur. Leadership, passion, self-confidence, and smartness. So what makes a successful entrepreneur? A successful entrepreneur is usually creative. They position themselves in shifting on new markets. When they see new ideas or they see the trend is shifting, it is moving from um, digital to AI, they also move with it. Not those that will say, no, this is the way my father or this is the way our teachers taught us. So that's the way we are going to do it. The market is shifting. The world is changing. We have to move with the world. They are using EMR services now. That's the electronic medical records. Some Nigerian hospitals, federal government have adopted it. Some others have not yet adopted it. They are still lagging behind. That is another investment opportunity in the medical field. Okay, go and propose the idea that, okay, we want to install these EMR services for you, which could be AI laden to assist your doctors, making it easier for them. A successful entrepreneur creates new products, they create a new process, and they create new delivery. The unsuccessful ones are usually poor managers with low work ethics. They are not efficient, they fail to plan and prepare. And usually, not always, they don't manage money properly. So, where do you start? And there's no fund. I don't have any support. I have no experience on entrepreneurship. I don't have any business idea. I don't have any business mind. Well, when starting, there's usually brainstorming and planning. Okay. So brainstorming is a technique used to help individuals or groups generate multiple ideas and alternatives on a particular issue. You don't have to do it alone. You don't have to um, think it's my business. I have to get the idea. You can expand. You have to be accommodating. Okay. Then business plan is a step-by-step outline of how an entrepreneur or the owner of an enterprise expects to turn ideas into reality. So it is actually a written description of how your business will evolve from when you start to where you are getting to. So what are the questions to keep in mind? What are my motivations for owning a business? What is my motivation? Do I want to be rich? Do I want to help the society? What is that motivation? What drives you to owning the business? That will tailor it to the type of business you want to go into. Should you start or you should buy? What and where is the market for what I want to sell? You can't go to, let's say, this is just a random example, so I'm sorry if it offends anyone, but it shouldn't. You can't go to Jigawa now, to a village in Jigawa, and say, where there's no light constantly, and say you want to install EMR for them. It's not feasible because you need light to work with the EMR. So another question is, how much will all this cost me? The monetary aspect is always very important. Should my business be domestic or global? Do I involve stakeholders in my business? How do I deal with competitions? But this dealing with competitions, in my opinion, some people might hold a different opinion. But in my opinion, dealing with competitions should not be at the start of the business. Once the business is stable and it is solidified, then you deal with competition. Please, am I audible?
Yes, you are, sir.
All right, thank you.
Thank you.
You go into the markets. When I say markets, I mean the type of business you want to do. Is anyone else doing what you want to do? If not, is there a reason why they are not doing it? They are not doing heart transplants in Nigeria. You want to start up a heart transplant, a heart courier service. Is there a reason why you want to do it when others are not doing it? So you search for potential competitors or partners within the market. It will help being focused. Market research is necessary so as to find out the local demand for healthcare products and services, the direct customers' needs, and the potential in the field and other crucial issues. Legalizing one's business is also very important. So you have to decide on the entity and register your business with relevant bodies. That's the CAC. Consult with professionals, potential investors and partners, and more for guidance. Remember, one cannot do everything on one's own. You need professionals. You might need an economist. You might need to have doctors if you don't want to practice. Even if you want to practice, you might need to still have extra hands. You want to have investors or stakeholders. So you have to consult other professionals, not doing it on one's own. Financing the business. There are many ways to finance business. When you think, how do I go about this? I don't have any money. I'm just graduating from medical school. You might have personal savings. Your families and friends can help. Cooperatives. You can join cooperatives during your house job period. That someone once referred to house job period as the richest phase of the medical doctor. Because then, yeah, the salary is not as much as that of resident doctors or consultants. However, there is usually no responsibility at that period. So all that money is for you. What do you want to do with it? You want to enjoy your life and spend the money? You want to gift people the money? You want to buy a car? You want to wed? You want to make a business? You want to put it into an investment or start up your own business idea? Then you can also get funds from partnership. Okay? You pitch your idea to stakeholders, prospective stakeholders, and you can get from them. You can also get funds from the government. You can also pitch to governmental agencies and so on. Okay. So developing the business, you need a brand. Okay. You need a brand to get followers, to get customers. You create a logo that can help people easily identify your brand. And you have to be consistent with it throughout the platforms, be it X, whatever social media platform it is, or physical, not virtual. You have to be consistent with it. So when one sees it, they understand that their brain is engaged that, okay, this is particular to this brand. Engage in promotion and advertisement to make target customers be aware of your product. You have to advertise. There are very few. Okay, there's this joke on a lighter note I saw on the social media that the only company or the only what would I put it? How would I put it? Item, yes, that does not advertise is St. Louis sugar. I'm sure some of us, if not most of us, know of St. Louis sugar, the cube inside the blue box. You've not seen the advert anyway. However, they are still selling. So the person said, that brand, Money Beraga, meaning they are very pompous. So that's on a lighter note. We need to advertise. We need to advertise to promote our brand. The future of a business always depends on the money you make, on the revenue and the sales. Sales is important for generating revenue and hence break even and profit. Next is growth, and there are many ways to grow. Growth is possible with effective marketing using all available and relevant platforms. Provision of qualitative products and services at reasonable price based on customer capacity is another strategy for growth. You want to give back to the society, which is the reason you're going into owning a hospital. Okay, now you want the hospital to grow. You have to consider the cost. Most people might not be able to afford your service. So do you reduce it? As a consultant, your consultation fee being 25,000 naira, do you reduce it? So if you want to grow, you have to consider the capacity of your target customers. The hospital I cited example at Abuja, their consultation fee is 100,000 naira, but they attract foreign patients because of how standardized it is. Another way or strategy for growth is availability of wide range of products and services. How can that be achieved? You own a hospital again, for example. You don't need to just consult, administer medication. The hospital could have a lab, a standardized lab that run tests that you can even come from outside, say you want to run, or they send you from another hospital to run a test. You can come to your hospital and run the tests. You own a pharmaceutical company. You can have a clinic inside the company. You can make a branch for oxygen tanks to deliver oxygen. Okay, so a wide range of products would give you a wider customer base, which would then help with growth of your company. However, you should recognize expertise in a certain area so as to complement your efforts. Do not play the medical expertise in your startup and handle the responsibilities of marketers, accountants, logistic officers, and all specialists at the same time. Like I said earlier, you cannot do it alone. Hire specialists to do it for you. Where's the money? When you pitch your idea to the company, to your stakeholders or to potential investors, all this should be included in it. Because if you say you are going to handle these things on your own, it might just crash. It might just crash. So if possible, involve the right person for the right job and sometimes delegate, as you cannot have full control of everything. Challenges likely to face. Low affordability of proficient healthcare. The poor and the rural population have troubles in accessing proper healthcare due to low income. You know, they earn lower than your consultation fee. What do? This is a challenge, but you have to overcome it. Part of being a good entrepreneur is identifying challenges, seeing them as opportunities. Okay. So if you want to cover this gap, you have to deal with challenges of breaking even or low profit. Collaborating with government or development partners with research, prevention, and curative measure programs may help you reach your financial and social goals at the same time. Collaboration is very important. Okay, you cannot do it on your own. Yes, some people will tell you they did it on their own. Yes, but look at the ratio. So collaborative method is usually more is likely to succeed, more likely to succeed. All right. So finally, you have to manage time and stress appropriately. You have to be patient and dedicated. You have to be current on government policies, be current on the dynamics of the market, and you have to network with professionals. In conclusion, medical entrepreneurship has been recognized as an important economic activity that is involved in providing unique products and services. It has been generating employment, wealth creation, and poverty alleviation, among others. So, to be a successful entrepreneur, a medical entrepreneur, one needs to possess the sterling qualities of an entrepreneur as well as follow the necessary steps. Okay, the opportunities, remember, are limitless, and the sky is just the beginning. You can think of anything and achieve it. Thank you very much.
Wow. Thank you so much, Dr. Adebisi, for that insightful and very extensive presentation. We've learned so much, especially that entrepreneurship goes beyond just starting a business. It's about identifying gaps and creating solutions, especially in healthcare, where Nigeria, for example, you said 4 doctors per 10,000 patients. You also emphasize the traits of an entrepreneur, the importance of market research, legalizing and financing a business, as well as branding and advertising. You also highlighted the need to start with brainstorming, planning, asking the right questions, and the importance of knowing your boundaries, hiring specialists where needed, and above all, embracing collaboration because we cannot do it alone. Thank you so much once again. So now we'll be going into the Q&A session. But before that, I would like Prof to share our remarks. I don't know if she's still on the call. Professor Abdulkareem, please, if you share your remarks. As scholars, you can type in
Yeah,
your questions as this goes on, please. All right.
thank you. Thank you very much, Mariam. Dr. Adebisi, thank you so much. In fact, when we were thinking about this topic, I was like, oh, will it really be useful to the scholars? Wouldn't it be talking above their head? And in fact, you've made it, you've so much simplified it and opened our eyes to so many areas that, we as medical personnel, we never think about, you know. You and I know that in medical school, all we knew was just read, 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 read. We never think about how to make money. You see, for instance, a family, your friends and family will call you even late in the night. They want you to be writing prescriptions for them. But a lawyer will never do any such thing, doing it free of charge. There's so many areas that we can make money from that, we'll still be able to provide social service, just like you have put it, and make impact and still be able to generate uh, uh, fun. So I want to thank you very much, and I really do hope that our scholars have gained one or two things. Yeah, even if they are not going to be using them now, they will keep them for later. And from all that have been said today, that I believe that there are several areas that you can tap into, even as you are medical. I mean, that you're still in school. So thank you once again, Dr. Adebisi. And I'm sure when we call you again, you will still be able to be there for us. Thank you. And even coming at very short notice as well. Yes, so please continue with the Q&A.
Yes, please, callers, if you have any questions, please type it in the chat box, or you can unmute yourself um, if you have any questions. No one has questions. Okay. Someone is asking, Yusuf Jimo is asking, please, sir, somebody always says you can't start a business with your money. How true is this?
Okay, thank you, Yusuf Jima. So there are different perspectives concerning this. To start a good business, usually, or to start a business, yes, you need capital. Does the capital have to be yours? Not likely. It doesn't have to be yours. But if you have that capacity, yes, you can. Remember, a business is an investment. Okay. So using using your own money or another loaned money does not make a difference. Okay. What makes the difference is how you run that business, how you run that investment. Okay. If you loan 5 million now to start a business and the business is not run well, you're at double loss. If you use your money, if you use your own 5 million naira to start a business and you run at a loss, it doesn't go well. It's just one loss. So there are different perspectives to it. Okay. Believing what someone says concerning you can't start a good business with your money is just the person's perspective. But what actually matters is how the business progresses, not where the capital is from. Do I answer your question?
Okay, I hope that answers your question, Yusuf. Adam is asking, thank you so much, Dr. Adebisi. Is it possible to incorporate business into medical education, or how do we get more training or education on entrepreneurship?
Okay, thank you, Adam. Usually, in some universities, the ones I know of, I know there are courses on medical entrepreneurship and medical economics. Yeah, so they do give courses on them. And if one wants to further their business knowledge, you can always go for extra courses. So more training can be gotten. You go for the diploma in business administration, and or you can go back to the university to read business administration for I think it's 4 years or so. But I think diploma usually suffices. There's also masters in business that can be done, and you get this business sense also. There are some books that can be read also concerning it, and they do help also. Thank you.
All right, thank you. Bisola Beatrice is asking, thank you so much, sir. With the kind of commitment required to be a medical practitioner, would you say one has to get to a certain level before going into business, medical or not?
Okay. So you don't need to get to a particular level in your medical practice before going into business. You can start right from house job. I have some colleagues that sell medical equipment. We did house job together. He used money from his house job, bought medical equipment, and he sells them. He's not practicing. Some others might practice and at the same time sell medical equipment. You understand? So you don't need to be or to have gone 5 years or 10 years into your practice before you start. The earlier you start, the better. Okay, because you gain experience and time is the most precious of all.
Okay.
Thank you.
Thank you so much, sir. Does anyone else have any questions? You want to unmute yourselves? If not, we'll just wrap up. Okay. Thank you again, Dr. Adebisi, for taking the time to be with us today and for sharing your knowledge and experience. Before we officially close, I'd like to invite Toiba again to give the vote of thanks on behalf of the scholars. Is Toiba still here?
Yes, I am. Good
Uh,
evening once again, everyone. I hope I'm audible. Good evening, everyone. I'd like to acknowledge.
yes, you are.
Our founder, Dr. Professor Abdulkarim Fatima. I'd like to acknowledge every other member of the FAJIM Medicare Foundation Board. On behalf of the FAJIM Medicare Foundation, I'd like to, and on behalf of every FAJIM scholar here, would like to extend our heartfelt appreciations to our speaker, Dr. Adebisi, for making it in his schedule to give us insight, to teach us, to share with us from his pool of knowledge on health entrepreneurship. We really appreciate you, sir. We appreciate your time. We appreciate your dedication towards teaching us. And we pray that you continue to succeed in all your endeavors. We pray that you continue to succeed in anything that you lay your hands on. And I'd like to thank the entire board of the Virgin Medicare Foundation for providing us with such opportunities in form of these sessions. It is an honor to be here. It is an honor to be regarded like this. It's an honor to have our growth being considered like this. We are thankful. We Virgin scholars, we are thankful to Professor Fatima for our relentless efforts towards making us better as healthcare students and future healthcare professionals. And I pray that Virgin Medicare Foundation continues to go to greater heights. May it bless everyone doing, may it bless everyone behind all the good works. Thank you so much.
All right, thank you, Toriba. With that, we'll wrap up today's session. Please remember to fill in the attendance form. Thank you once again, Dr. Adebisi. Thank you all for joining. Until our next session. Have a good day.
Thank you, everyone. Bye.
Thank you so much, ma'am. Bye, ma'am.
All right.